Pretty interesting. Did you know that any degree of hearing loss, whether mild, moderate, or severe, affects a child's ability to process sound and subsequently develop age-appropriate educational and language skills? Direct teaching of vocabulary, language, and social skills can benefit children with hearing loss, and the Buffalo Hearing and Speech Center can provide a variety of programs and techniques to help increase their language and literacy skills. Here to tell us more about all of that they have to offer at Buffalo Hearing and Speech Center is Lynn Shea and Tracy Ballin. Thank you both so much for being here. Let's start, Lynn. Tell me a little bit about Buffalo Hearing and Speech Center and what sets you apart.
Okay. Buffalo Hearing and Speech Center has been in existence for 60 years. We're celebrating our anniversary this year. We're the largest speech and hearing center in the country. So and the services that we provide are for birth through geriatrics. So we have an early childhood program which services kids who are diagnosed with autism, hearing loss, or have speech and language delays. And then we have a speech and hearing clinic, which is the other portion of our center, which full audiology clinic, which services all types of hearing loss. We dispense hearing aids, and our speech and hearing clinic, which does a numerous of different things where they provide speech and language services through insurances. We contract with other agencies as well as school districts, so we're sending therapists out into the community, and we have our language to literacy program as well as other specialized programs.
So a huge umbrella of services that you have at Buffalo Hearing and Speech. Tracy, if a child's diagnosed with hearing loss or some speech issue, what are the steps that a parent should take?
Well, first and foremost, it depends on the age of the child. So if the child is between birth and 3 years of age, it would go through their county, the county of residence that the family is in. So they would contact their county early intervention program. If it was a preschool child, age 3 to 5, they would contact their school district. From that point, either the district or the county would do some evaluations, kind of evaluate the child on their language skills, educational skills, points in those developmental milestones, and from there, based on that, determine what kind of services are needed for that child. Then the parents from there really want to get some amplification, go follow up with an audiologist, get the child amplification, and determine what kind of communication approach they want to take with their child.
And I'm glad you brought up approaches, because tell me a little bit about the type of approaches that Buffalo Hearing and Speech offer.
There are a variety of approaches. You have our total communication, our American Sign Language approach. However, Buffalo Hearing and Speech Center in our oral deaf education takes a listening, spoken language listening approach. So we really focus on teaching children to talk as their primary means of communication rather than teaching them American Sign Language or sign language skills. So our philosophy is that with the technology today that we can teach children to listen and speak.
That's amazing. And what about the programs that are offered at Buffalo Hearing and Speech? Tell me a little bit about them.
That is our oral deaf education program, which again, like Lynn was saying, focuses on that listening and spoken language. So we provide intensive intervention, individualized instruction for the kids, directly teaching concepts and such that kids with hearing loss often have a difficult time picking up without being directly taught. They get specific training to develop their listening skills, which help, of course, their spoken language skills. And our goal is to mainstream them by the time they're in kindergarten. So we're looking for our kids to have those age-appropriate developmental skills by the time they are 5 years old, so that they can go to school with their age-matched peers in their district kindergarten.
And Lynn, if a parent isn't sure, can they get a referral, or can they go right to Buffalo Hearing and Speech and have you guys take a look?
Yes, the first thing is to figure out what their hearing loss is. So they're going to go through the audiological evaluation and then be fit with hearing aids or a cochlear implant, whichever is needed. As far as educational, our children, we can see them through our clinic, but if they're really in need of an educational program, then that goes through the Committee on Preschool Special Education or New York State Early Intervention Program. So it's a matter of contacting either their district or the county, depending on their age level, for services that can be provided.
Thank you so much for all this great information today. Nice to have you here. The Buffalo Hearing and Speech Center improves the quality of life for for adults, children, and infants with communication disorders by delivering cutting-edge diagnosis and treatment of hearing and speech impairments, and by offering related special education services. If your child's been diagnosed with a hearing loss, or if you suspect that may have one, you owe it to yourself to contact them at the Buffalo Hearing and Speech Center, located at 50 East North Street in the Buffalo Niagara Medical Campus. More information is available online at askbhsc.org or by calling them at 885-8318. Find out what they can do for you. Well, that'll do it for us for this week's edition of Western New York Living. We're glad you could join us, and we'll see you next Saturday morning. Bye-bye.
This segment of Western New York Living was paid for by Buffalo Hearing and Speech Centers. Special consideration for today's show paid for by the following: